So I think we can continue with our second speakers today. She is Lisanne Bakker. She's a PhD student at the University of Groningen, again in the Netherlands. And her work is focused on neural correlates of balance learning in aging. Today she will discuss her first paper. Congratulations for the paper publication, where she investigates the task-specific and neural adaptation after a single balance training session in healthy young adults. So please, Lisanne, the floor is yours.
Thank you, Alberto, for your nice introduction. So my main focus of my PhD is focused on balance and learning to balance. And balance is something that declines with an increasing age. So we see that elderly, of course, fall more often. But luckily, there have been developed balance training programs. These usually take several weeks and consist of several balance training interventions. But they do show that they can improve balance performance, reduce the number of falls, and also reduce the number of injuries in younger adults. However, as I said, these usually take several weeks. But a study by Van Dien et al. Showed that participants were trained for 30 minutes to stand on one leg on an unstable board. And just these 30 minutes was already enough to lead to substantial balance skill acquisition. So maybe we wouldn't need such a long training period, but actually just a short training period, similar to the skill acquisition that we see in manual skill acquisition. You just need a short period to improve balance skills. So while Van Dien showed that it's possible to learn a skill that quick, we are not yet sure if you're also able to retain a skill that is a balance skill that is acquired so rapidly. We also want to know if it is transferred to other balance tasks, and we want to understand the underlying neural mechanisms. So therefore, the aim of this study was to determine the effects of a single balance training session on balance skill acquisition, retention, and transferability. And also we want to examine the neural mechanisms underlying these behavioral adaptations. So we expect that balance training or balance skill is best acquired when you actually train the specific balance skill, but we did want to control using an active control group to see if not just being active already leads to an improvement in balance performance. And we also use a non-active control group. Then we also expect that the improvements will transfer to the non-trained balance tasks, and we expect to see a correlation between the behavioral and the neural adaptations. How did we examine this? We included 36 healthy young adults in the study. The mean age of that was 21 years old, and they were randomly allocated to one of three groups. So on the top here, you see a balance training group. They would stand on an unstable board for 20 minutes. Then the cycling training group, they would be sitting on a stationary cycle, also for a duration of 20 minutes. And the non-active control group would just be seated during the intervention part of the experiment. The measurement, this consisted of 2 different days. So on the first day, there was a baseline test, an intervention, and then a post-test. And then after 7 days of rest, there was a second day of measurements, and the participants came back for a retention test. And during each of these test moments, these measurement moments, we assessed both the balance behavior as the neural excitability. I'll tell you a little bit about how we measure that in a bit. And we also collected during the first day questionnaires, for example, about physical activity and sleep quality. So balance performance was assessed using 3 different tasks. First, we assessed it on the Wobble board task. This is the same task that the participants in the balance training group also trained at. So they would stand on this board and they were instructed to keep it as horizontal as they could. And we would extract the time that they were in balance. Next, we also looked at a beam walking task. So during this task, participants had to walk over 2 different beams with different widths. And we assessed how far they were able to walk on these beams before and after the intervention. And the third task was a static balance task. So they would be standing either on a stable surface or on an unstable foam surface We also had other tasks. So for example, eyes open, eyes closed, and feet in like a normal stance or a narrow stance, so feet next to each other. And we examined the center of pressure velocity because they were standing on top of a force plate. So it allowed us to extract the center of pressure velocity. Then we also looked at the neuroexcitability. So we used two different techniques for this. On the left, you see intermuscular coherence. We mostly looked at the intermuscular coherence in the alpha and beta frequency bands because this gives you an idea about the input to the muscle pairs coming from the subcortical and the cortical regions. So we looked at both synergistic muscle pairs, as you can see here, soleus, lateral gastrocnemius, peroneus longus, and also antagonistic muscle pairs. So included the tibialis anterior, the soleus, and also in the bottom, the rectus femoris and the biceps femoris. The next thing we did was we also looked at, oh wait, I want to say one more thing about intramuscular coherence. We collected this data of intramuscular coherence during this static balance task. So while they were standing on different surfaces and with eyes open, eyes closed, etc. Then we examined the transcranial magnetic stimulation. So using this TMS, we looked at the motor evoked potential, the MEP, but we also looked at short and long intracortical inhibition and intracortical facilitation using different interstimulus intervals and different stimulus intensities. So this allows us to, this gives us information about the cortical, but also the subcortical input to the muscles. So what did we actually find? On the left here, you see the performance of a participant from the balance training group at baseline and at post-test. And what you see is a deviation of the board in the medial lateral and in the anterior posterior direction. And this orange circle right here is a target circle that was also displayed for the participants in front of them on the screen. So the participant was supposed to keep the board horizontal. So we would allow a deviation of 5 degrees from the horizontal as being in balance. And as you see, before the participant had a really tough time to keep their board in balance, but after the 20-minute training period, they really improved their performance very much, and they were able to keep it horizontal almost all of the time. And when we look at the group level, you can also see that, because here on the left, we have the baseline versus post-test differences, so the improvement after just 20 minutes. And here you see a balance group, the cycling group, and the control group. This line over here is displaying the mean of the group, and those dots are the individual different scores for every participant. So you see that on average, they improve almost 339% in the balance training group, which was significantly more than the other two groups did. And then when we looked at the retention, so this is the baseline versus the retention scores, we see that the balance training group still scores, is significantly improved more than the other two groups did. However, we did not find any significant change in the standing balance and in the beam walking task, so we did not find any transfer. And also we did not find any neural excitability, any changes in the neural excitability. So now I will discuss these findings with you. Let's start with the main find of the study was that we found a really big improvement in the task that was trained. It was 339% improvement compared to baseline on average. And this is larger than the session normalized improvements that we see in long-term studies. And in addition, we also see that in the study from Van Dien, we saw that a lot of the improvements that they found in their study already occurred in the first 16-second long trials, which shows, makes us suspect that similar to manual skill acquisition, it is the rapid initial learning that dominates the balance improvements, also in longer term studies. So we expect that most of the improvement, even in long-term studies, already happen in the beginning, in the first few sessions. Therefore, future studies should examine the time course of these adaptations in more detail. So they shouldn't only examine the improvement after 1 week, for example, or after several weeks, but really look at what's happening, because maybe most of the change is already happening really quickly. And then we didn't find any transfer even though we found such a big improvement in the trained task. And this is actually in line with the study from 2015 that shows that there was no transfer even between very similar and challenging balanced tasks. And there's also this paper that looked at all the different intercorrelation between the tasks, between different balanced tasks, and it was actually quite low. And when we looked at intercorrelation in our tasks, between our tasks, we actually saw only a medium intercorrelation between the tasks. So here there is the distance walked on the balance beam, and here there is the time in balance on the balance board. And you see it's only correlated 0.4. And this implies that there are low mechanistic links between the tasks. So for example, in our task, they are training to counter the rotations of the board, but this is not very useful when you are standing on the floor. So therefore, in future studies, they should include a test task that is similar in spatial temporal structure to the trained task. And then lastly, the lack of neural adaptations. So we found a dissociation between the behavioral adaptation and the neural adaptation. This might be due to the time course. And possible that the behavior adaptation occur at a faster rate than the neural adaptations do. Another possibility is, I think that we assessed our neural adaptations during either standing task or the TMS, we assessed it during sitting and standing. However, we did not assess these adaptations while the participants were standing on the balance board. So, these studies show that they were only able to detect these neural adaptations when they assessed them during a postural perturbation or during a task that was very similar to the trained task. So we think that in order to really capture these neural adaptations, they appear to be really task specific. So this should be considered. And also the time course of the neural adaptations also has to be considered in future studies. So in conclusion, we found that just 20 minutes of balance board or wobble board training led to acquisition and retention of a new balance skill. However, we did not find any transfer to other balance tasks. And also we did not find an effect on neural excitability by examining, looking at the TMS measure and the intramuscular coherence. Therefore, in future studies, they should consider the time course and the task specificity of behavioral and neural adaptations. So if you want to examine the neural correlates of balance learning, it's important that you take these behavioral and neural adaptations, like that you assess them during the trained task and at multiple time points. Thank you all for your attention. Are there any questions?
Thank you very much, Lisanne, for your great talk. Very, very interesting. And while we wait for question from the audience, I have a question myself. So could you please re-explain me how the TMS protocol worked? So where did you stimulate with the TMS, and where did you record?
Yeah, so with the TMS, let me go to that slide. So we stimulate the motor cortex, but we stimulate the area of the tibialis anterior muscle. And so we collect the muscle activity and we stimulate that specific area. And then using different intensities and different interstimulus intervals. So if you just give a single stimulus, you will just get an MEP, a motor evoked potential. Which looks a bit like this, but when you use SICI, so here you can see there are two different pulses after with only really short interval between them, that actually causes inhibition, and you can see that that this peak is actually smaller than it would be if it was just a normal MEP. And that's also what you see here in the leaky, the long intercortical inhibition. So we can see the inhibitory and facilitatory mechanisms of the brain using this technique. Does that answer your question?
Yeah. I didn't get the details. Thank you very much. Oh, we have one question from JJ. Do you think that longer transfer could improve the transfer to other tasks, and that transfer only take place later in training, longer training?
So if longer training can improve the transfer?
The transfer, yes.
Okay. Yeah, so I'm not sure about, I think if you train longer, it will maybe lead to, for example, strengthening of the muscles, which could lead to a transfer on the longer term. But as I said, these tasks are quite different. So I'm not sure if training of a balance board task could lead to an improvement on the balance beam.
Okay, perfect. Thank you very much, Lisanne, for your question and for answering for the talk and for answering the questions. And I think we should move on.